I became interested in international work since I was probably in high school. I knew that I wanted to do something related to international work, and once I decided I wanted to go into medicine, I was certain I wanted to do something related to global health, as we now call it. And my first exposure was in medical school, but that was from a research end, and my first clinical exposure was actually as a resident here in this hospital when I did a rotation in both my second and third years. I did call-free electives in children's hospitals, first in Argentina and then in Chile. And those were really career-forming experiences. I knew at that point what my specialty was going to be, and the research question that I'm still working on now, many years later as a faculty member, is directly related to the experience I had as a second-year resident. I feel that international experiences are enriching for residents, even those who are not going to go on to do international work, because it allows them to have exposure to what life is like in different settings, what it's like to do healthcare without a lot of the high-tech equipment that we have here. And it allows also, I think, a much greater empathy with many of our patients who are coming from many of the settings that one can go to visit. And I think the understanding one has once one has visited homes in different societies really gives a very different outlook on understanding what it means to provide care even here. My present work is on research related to understanding etiology for retinoblastoma, which is work that I first became interested in as a result of the rotations that I did as a resident. I have had NCI funding to look at effects of prenatal exposures and early infancy exposures on development of mutations in the retinoblastoma gene in the unilateral form and sporadic disease. And I've had a long-standing collaboration with a number of institutions in the Mexico City area, really studying incidence of this disease in central Mexico.